My name is Dr. Paul Knoll. I'm a board-certified urologist here in Nashville, Tennessee. I'm making a series of videos to talk about certain medical conditions and then see if there's management options for those conditions. So let's get started. Hi there, I wanted to talk to you about prostate cancer today. Prostate cancer is something that is very common, and we'll dig right into how to determine what to do with the type of prostate cancer that we have. So, when we look at prostate cancer, we determine, is this something that we need to treat or do we not need to treat? And how do we look at that? So when prostate cancer is not aggressive and has a low chance of leaving the prostate going to the rest of the body, that's the type of cancer that we just watch. That's something called active surveillance. If it's more aggressive and there is a chance that it can spread outside the body and cause problems down the road, that's when we tend to do a treatment option such as radiation or surgery. Your pathology will be discussed with you to help make the best decision for you. Now, how do they determine the level of aggression of prostate cancer? First, the pathologist will assign a score to the prostate cancer, and that's called a Gleason score. And for whatever reason, they started off as Gleason 6 as the lowest one, but Gleason 6 through 10. The higher the Gleason score, the more aggressive that the cancer is. So the way they have risk stratified prostate cancer is that there is a low risk, an intermediate risk, and a high risk. The risk means what is the chance of it leaving the prostate, spreading to the rest of the body. So a Gleason 6, for instance, is the lowest risk, and that is the one that's least likely to spread outside the prostate, and those are the ones that we just watch, aka the active surveillance. We're actively watching it, but we're not treating it. Then we have the intermediate risk, an intermediate chance of spreading outside the prostate, and that's usually a Gleason 7. Within the Gleason 7 range, there's a favorable type and an unfavorable type, and we'll discuss that with you. And then the high risk one is 8, 9, and 10. Those are the high risk type. That's the ones that definitely need treatment right away. And also imaging too to make sure it hasn't already spread outside. So what do we do next is we look at how much volume of cancer was involved. We take about anywhere from 12 to 20 biopsies or cores or samples. Anything above 3 or 4 is considered higher volume, but the Gleason score is the most important, with the type of volume being the second most important kind of factor to determine what we do next. Let's say we do have the Gleason 6 or a favorable 7. These are less likely to leave the prostate and spread to the rest of the body. That's when we do something called active surveillance. This is watching cancer, we're not treating it. And it's consistently monitoring to see if that prostate cancer progresses. How do we do that? We draw PSA, which is the blood draw. We'll throw some MRIs in there that help give us further information, and then also other biopsies. Let me give you an example of how active surveillance may work. So PSA every 3 months, an MRI at 6 months, and a biopsy at 1 year. So for instance, if the PSA and the MRI are stable, then we perform another biopsy at 1 year. But say at that 3-month mark or at that 6-month mark, if your PSA increases or MRI looks suspicious, then we move that biopsy up sooner. After 1 year though, the active surveillance algorithm can change, and that will be discussed with you with your provider. The goal is to monitor cancer as long as possible. We would move to treatment if the cancer progresses. Low risk cancers aren't treated anymore. That's why active surveillance became this very popular management option. And it is incredibly rare for there to be an immediate progression, meaning you wouldn't have a low risk type of cancer, then all of a sudden it became spread everywhere throughout the rest of the body. Let's talk about the pros and cons. The pro is that there's minimal side effects. It's just the side effect of blood draw, getting an MRI, and a well-tolerated biopsy. And the other pro is that you're avoiding the side effects of treatments, such as the radiation or surgery. The cons though is there is a chance of progression without treatment. However, that is a very low risk as discussed before. And we'll go through all these options with you. Just wanted to give you an outline of what's available out there. Again, prostate cancer is something that's very treatable. We just need to get it to where we're picking the right option for you.